Hello, it's Stephen-Castro again. Welcome to Complex Concepts and our brief overview of rheumatoid arthritis. Let's start with the definition of rheumatoid arthritis. So, rheumatoid arthritis is an inflammatory disease. They typically have pain, swelling, stiffness, and loss of function in the joints because the immune system attacks the membranes lining the joints. It is an autoimmune disorder. There is about 1.5 million people affected with rheumatoid arthritis, and it's about 0.6% of the U.S. population, of adult population. All races and ethnic groups. Usually starts at middle age. It gets more frequent as they get older, and it happens more frequently in women than men. The etiology of rheumatoid arthritis is really inconclusive. They do believe that it's a combination of genetic, environmental, and other factors. Genetics such as the HLA-DR gene, which is listed in your book, environmental factors such as exposure to the Epstein-Barr virus, as well as other factors like hormones. Just review the pathophysiology that's listed on page 318 of your book, The Medical Surgical Nursing. Manifestations may range from mild to severe. It also may be dependent on which stage of the disease process they're in. Typical manifestations may include tender, warm, red, swollen joints, that symmetrical pattern of the affected joints with lack of function, and the joint inflammation often affects the wrist and those finger joints. Manifestations may range from mild to severe. It also may be dependent on which stage of the disease process they're in. Typical manifestations may include tender, warm, red, swollen joints, that symmetrical pattern of the affected joints with lack of function, and the joint inflammation often affects the wrist and those finger joints. While there's not one specific test for rheumatoid arthritis, it's usually done in conjunction with a history, the physical exam, and a series of tests that reflect the immune system, such as the rheumatoid factor, the ANA, serum complement, SED rate. There's a list of lab tests on chart 18.8. Other diagnostics may include an X-ray, and they like to do a baseline and then check it every few years just to make sure how much joint involvement is going on, possibly a CAT scan, and also an arthrocentesis, and there's more information about the arthrocentesis in your book. Once you've analyzed your data, it's time to prioritize some goals. So there have a lot of chronic inflammation and pain, and a lot of potential for decreased mobility. So I'd like to relieve that pain, reduce the inflammation, slow or stop the damage if possible, and improve their overall function. Medications are an extensive part of treatment for rheumatoid arthritis. They also may have to have surgery, such as a joint replacement, an arthrodesis, tendon reconstruction, or the synovectomy. Routine monitoring will be necessary with labs and x-rays, and there's some other alternative therapies available. Treatment for RA will revolve around medications, NSAIDs for anti-inflammatories, also corticosteroids, which also help fight that inflammation process, DMARDs, and please pay close attention to methotrexate since it's so commonly given, as well as those biologic, which is another class of the DMARDs. Some non-pharmacologic interventions can include rest or energy compensation. RA clients are typically very fatigued. Ice may be needed for hot joints, and conversely, heat or warmth for stiffness or morning stiffness. They also may do plasmapheresis. I know this was kind of short and sweet, but if you just kind of focus on the information that I've outlined here, do your guided reading that I provided for you in Blackboard, and focus on the meds that I've kind of listed here in this very short PowerPoint. I know there's more listed on my other PowerPoint, but if you focus on the ones here, you should be good to go.